Thank you for the opportunity in presenting the journey of CBMH to UGM UNESCO chair. Before we presenting these issues, I would like to say something about this one. This is really a good opportunity to present the journey of CBMH to UNESCO Chair of Bioethics at UGM. During 20 years long journey, I believe that the new millennial generation have too, indeed they have, in taking over the role in developing bioethics scientifically. So that's why in this opportunity, I please to Dr. Azit Mahardinata as one of our millennial generation to present together with us and with me. And please, Dr. Azit, to continue this presentation.
Yeah, thank you, Prof. for the opportunity. As introduced, I'm Dr. Nur Azit Mahardinata. I am one of the, well, I will not call myself a millennial generations because I'm not that millennial, but I'm one of the young at the Center for Bioethics and Medical Humanities. But we don't differentiate people by age. So young, old, and every race, every people has the rights to speak about bioethics. So what we are going to present is about the journey of our Center for Bioethics and Medical Humanities, from something to, we hope, everything. From small thing to big things. So we are presenting from the commitments, the aims, and how we manage our staff, and then who we are collaborating with until now, and milestone, and hopefully it will give you descriptions, better descriptions about us. And for those who has not been involved with us, then you will know who we are and what we are capable of. Okay, next. Can you make it as a slideshow? Yeah. Okay, these are the commitments of bioethics. Can I just stand, Prof? Because it's more convenient for me to stand. Yeah, the bioethics, our Center for Bioethics and Medical Humanities, we have what Prof. Soenarto mentions is 4 commitments. The first is we are committed to scientifically responsible for what we are producing. So we are doing our activities based on facts, based on scientific responsibility. And the second commitment is that we will always improve our capabilities on research and how people and communities can benefit from the work that we have done. And the third commitment is that we will always trying to increase not only numbers, but also the qualities of the works and our publications in bioethics. A few days ago, the Dean from Faculty of Medicine, Public Health and Nursing, University of Gajah Mada has challenged us that because bioethics in Indonesia until now, it still has a minimum number of scientific journals. So this is a challenge that we have to face, and we have to better on this. And the fourth commitment is that we are, as the nature of bioethics science itself, bioethics is a transdisciplinary science. So this is not a monodiscipline, or not only physicians, not only philosophers who should be able to do bioethics, but everyone. So because bioethics is a transdisciplinary sciences, we will do our best to work together with all sciences, with all disciplines, to encourage bioethics in all the disciplines, not only in UGM, but also in other parts of the world. Next. Our aims, the main aim of the center is to be the excellent on everything. That's actually the aim and the goals of our center. But one thing that Prof. Soenarto would like to stress is about the current issues in clinical ethics audit. This issue is typically in Indonesia because we believe that by doing clinical ethics audit, this is an alternative to increase the quality of healthcare in Indonesia. We believe that, and we are going to do this for the following years. Next. These are the key persons other than Prof. Soenarto, Prof. Yati, Prof. Rika, and us in bioethics who also has a huge impact on our work. So these three these three persons is from teaching hospital, Dr. Paulus Sudiharto, and 2 other universities in Jogja. This is just like to show you that we are willing to work with everyone. We are willing to work with anybody as long as you are willing to work on the bioethics issues. And about the collaborations, we are collaborating with national and also the local organizations. So the 3 national organizations like CBMH, the Network on Bioethics and Health Humanities, who are held in Jogja in 2000. And we are now is a permanent secretariat of the CBMH, and we are going to improve the activities of CBMH for the following years. And the second is National Bioethics Commission. And for the time being, unfortunately, we have to inform you that National Bioethics Commission is in a dormant state because of the problem at the organizations itself, at the LIPI. So we are committed to help the National Bioethics Commissions to overcome these issues. The third is Persekin, is a National Medical History Association. So this is one of the most interesting issues that we are going to develop for the following years, and also with medical doctor associations. That's the national collaboration, and these are the international collaborators that we are now is still developing and have a good relationship. Okay, and then this is not by because the mic is already had a masker on, so I lose mine. And these are the list of the international collaborators that we are still working on right now. And hopefully we will keep adding the numbers of our international collaborators. So this is the old friends of Center for Bioethics and Medical Humanities. This is not by some orders. This is just we are going to doing the list. So the first is Harvard Medical Schools, and then IMC UvA, University of Amsterdam, and then University of Washington at Seattle. Next. Monash University, and several universities, 7 universities in Yemen, and then CPEC SIUT with Professor Amir Jafri, Professor Farhan Muazzam, and others, and also Bangladesh Bioethics Societies. Next, yeah. Okay, that's the national and international collaborators, and now we are presenting to you the target of development in 2020 and until 2030. Hopefully in the next decade, we will be able to do this. First is internally, this is the internal issues under the University of Gajah Mada, that we would like to be one of the department of bioethics, because this is not what we want, but this is the mandate from the Medical Education Act. So this is a must, and we, as we are working on these issues for a long time, we do hope that this, for the next decade, this will happen. And the second target is the UNESCO chair, and praise to God that the UNESCO already sent us the agreement, and we are now in the phase of appointing by the UNESCO. The third target is mainly about the challenge from Prof. Soenarto to us, the young, to be able to increase our intellectual capacity on how we make textbook, on how we be a better bioethics teachers for the students, and also for research and publications. The other challenge, the target from Prof. Soenarto, is also one of the, well, this is rather political issues, but about bioethics for science diplomacy. This is an issue that we would like to raise, because what we are now facing, COVID and other healthcare issues, it's also has political issues in it, and we would like to take part on the bioethics and diplomacy. And the other targets is the internationalizations of bioethics master programs. So this is one of the main work that we are going to do with Professor Yayi Suryo Prabandari as the leader in this matter. Next. Yeah. One thing that we would like to stress is about the importance of bioethics, the target on what's the importance to be the Department of Bioethics in the faculty. Before that, the reasons why Department of Bioethics should be developed at Faculty of Medicine, Public Health and Nursing, UGM. One thing that, well, this is must, that teachers, every teachers in Gajah Mada will not be able to have a career development, a decent career development, if he is not attached at one certain department. And although bioethics is a transdisciplinary department, then we would like to, transdisciplinary science, we are still need to have a bioethics department as the place for the young to have a decent career development. That's one thing that Prof. Soenarto would like to stress in these presentations. Next. These are the milestones. I believe in the next sessions, Prof. Yati and also Dr. Wika will present this more in details. Next. Next, this is still the milestones. And contributions of bioethics in Indonesia for the global society. So we already discussed about how we collaborate with international and the local, and now we are going to present about the contribution of bioethics to the global society. What we do nationally is we increase the capacity of bioethics teachers in Indonesia by courses that we've done. We call it help courses. And the others that we would like to do for the next years is that we will, as a bioethics UNESCO chair, we will be one of the trendsetters in bioethics courses and workshops, hopefully for the Asia and Pacific regions. Next. I believe I already did this. Okay, next. And for the summary, this is one of the most interesting slides that Prof. Soenarto has. So we would like to stress that bioethics started from the 1995 in the Faculty of Medicines. Now we have center as the National Center for Training in Indonesia. Also, we are going to have a department, and then we are going to have the International Postgraduate Master Bioethics in UGM, and also we would like to be one of the UNESCO Chair on Bioethics as soon as we receive the contract from the UNESCO. Next. Thank you very much for the opportunity. Prof. Soenarto.
Thank you, my dear. This is also one of information that in our program of a master degree program on bioethics, we have graduated 2, and the next month maybe 3 students. And we follow to continue not only with the student from Indonesia, but also the student from international or Southeast Asia. That is my name, and thank you very much for the opportunity in presenting this one to all of you. Thank you.